Okay, perfect. So welcome everyone to the next webinar. This one's on behavioral economics research in India, and this is obviously a super important topic to discuss, and it's a topic which is personally close to heart. And we have great speakers with us today. Before I introduce them, just some initial information is that it'll be really nice if you all introduce yourself with your name, where you're from, and even your research areas if you're working on something in the live chat session. So we, have some kind of interaction. And also feel free to write your comments, questions on the live chat, and you can also start conversation with each other. And I really hope you all have a very productive session. Just a quick intro about IBEN in case you don't know us already. We are a non-profit organization working towards sort of leveraging behavioral economics in India. So we connect students, researchers, academics, policymakers, and corporates in India. To introduce the speakers, we have Pawan, who is the director of CSBC, the Center for Social and Behavior Change. And he's also working closely with Niti Aayog to help set a behavioral insights unit for India, which is something that we are all really excited about. In the past, Pawan was the director of CES Nuffield Flame Lab, and he's also taught at a lot of universities, which I thought was really interesting. He taught at IIM Bangalore, IIM Ahmedabad, and Michigan Law School, which was really interesting. And we have another really interesting person. We have Sharanya, who's the Associate Director of Policy at JPAL South Asia. She has a master's from LSE and like many, many years of experience working in policy space. We're really excited to have both of you, and I'm pretty sure everyone attending the webinar is also super excited to have you both with us. So this is how the session would be structured. So we'll have the talks from the speakers, and then we'll have a little bit of discussion, a tiny announcement after that, after which we'll have the question and answers from the audience. But the audience can feel free to like ask you questions whenever you want in the chats, and we will go through it and add the questions in the end of the session. So over to you, Pawan. You can start with your talk.
Yeah, thank you, Junofi. So 15 minutes to talk a little about a particular project that we're doing. First of all, at the very outset, uh, my deep gratitude to you for inviting me and then also reconnecting me with an old JPAL friend, that is Sharanya. So it's indeed a privilege to join you in this vibrant network. I've heard about you guys for a while now, and it's we should actually collaborate and work together. Um, CSBC is just to give you some preliminary notes about the type of research that we do and the particular project that we are doing, that we did, is an illustration of that of a particular approach that we needed to take in order to work with the government. So CSBC was created by the Gates Foundation with an ambition to create a behavioral insights unit in the country, a nudge unit, as it were. And so basically, we have done that. Although we are located out of Ashoka University, we have an embedded unit out of Niti Aayog. It's a couple of months old. The team is a couple of months old there. A lot of our work over the last 1 or 2 years has been sort of paralyzed by the pandemic. Uh, but I wanted to start off by placing a couple of caveats about the nature of the research, because when you're working with the government, when you're working in a policy context, it's distinctly different from the kind of research that comes out of academic institutions as such. For instance, JPAL is a sister concern. It's and the standards of rigor that they have are immense. And but when we work with the government, the nature of the beast is that we need to come up with solutions very, very quickly, and so our time frame tends to be much smaller. The outcome variables tend to be different. The work that we do is typically called lab in the field kind of work. It has a lot of academic shortcomings, but nevertheless, we hope to make up with pragmatism. So just to sort of illustrate the kind of work that we do, I thought I'd take you through a couple of slides on this really important work on complementary feeding, which relates to child malnutrition. Can I, let me see if I can share my screen here. Yeah, there I am. Yeah, so so this is about complementary feeding. Complementary feeding is an indicator that is used by the government, that is measured to evaluate the state of nutrition. It relates to how we can get children above the ages of 6 months to start eating diverse foods more frequently and as a minimum assured quantity. So it's a very important sort of measurement that tells us about the state of affairs of child nutrition in the country and so on. Moving forward, CSBC is a bit of a pluralistic organization. We are not just experiments. We're not just about experiments, but we also do a certain amount of qualitative, formative research before we run our experiments. So the initial part tends to be sending people into the ground, having conversations. We do ethnography, come back with an understanding of the behavioral barriers to change. Then that basically then informs us, informs our design of interventions. Then we sort of go through a process of design, we create the interventions, and then at the next stage, we then go to the testing phase, which is really the lab in the field experimental work that we do, where we have randomization and so on. Post the testing phase, if indeed some of our interventions uh, are likely to work, or they indicate that they're successful, then we can go to a higher stage, which is to perhaps do a field experiment uh, along the lines of Poverty Action Lab, JPAL, and what Sharanya's team does. So this is sort of the mix of methods. This is the supply chain of the research process that we undertake. Just to illustrate our commitment to lab in the field, this is a bus that we until very recently had. It's a lab in the field, really speaking. I mean, we can drive the bus anywhere. It was equipped with computers, and we can park it in a sugarcane field or a low-income neighborhood and run our experiments there. So we still have that methodology, we still have that equipment, and this is something that we wish to take forward. This is indeed our lab in the field, which we had built along with Busara in the past. We still have access to a bus, and we still have the methodology to sort of get back into a bus and drive into the field and run our experiments. So moving forward, the problem itself, complementary feeding. So close to 35, between 35 to 40% of children under the ages of 5 are adversely impacted on measurements of nutrition, and that's a pretty serious number. It's quite a grim story, really speaking. And one of the key things that one needs to do is to try and get parents to give the children food more often. In other words, to increase the frequency, to diversify the kinds of food that they consume, and also ensure that they eat a minimum quantity of the food. So these are the sort of the three embedded aims in this problem statement. And we did some diagnostic work and discovered that a lot of these goals are not being accomplished, possibly because the kind of instructions that go into the field are really complicated. The guidelines are really jargony. They're full of information. There's an information load and so on. So it's a fairly straightforward context where you can do things which can simplify the instructions, which can simplify the message, and then hopefully that will produce the required behavioral change among the parents to ensure that the kids are fed in an appropriate manner. So that's the sort of the problem statement that we have here. And then, so we designed a couple of interventions. The first intervention was a fairly straightforward one. We relied on creating small little social groups of young mothers on WhatsApp. We had an enumerator who sort of moderated the group, who sent out messages and so on. So it was a sort of a hands-on kind of a group with conversation going on and so on. And the whole sort of engagement lasted something like 14 days or something, around 42 weeks. That was the sort of the, broadly speaking, this is the treatment that we used. Well, now you might wonder why are we, is, is the reason, are we moving towards this digital way of deploying the intervention only because of the pandemic, or are there other reasons? There are other reasons as well. And you know, to accomplish scale in this country, it's to use the community-based approach can be very tedious, very expensive, because we are a country of 1.3 billion people. And maybe using the digital method might be a way that will allow us to reach a larger number of people. And that's one of the reasons, that's also an additional reason why we thought we should experiment with a digital mode of deployment of an intervention. So this is the socializing complementary feeding and making it a visible activity through these WhatsApp groups. That's the intervention. And then we also had a second treatment, which basically relied on a script, and it was involved a phone call based form of counseling, where people would make phone calls to the parents, and then have a conversation and talk about the aims and so on, but in a simplified manner. The scripts are more or less the same between the two treatment groups. So this is, broadly speaking, these are two broad sort of treatment groups that we created. And in terms of outcomes, as I specified earlier, we were interested in looking at the minimum diet diversity and the minimum meal frequency, and minimum adequate diet. That's the quantity that is given to the child. And the sample involved mothers of children between 6 to 23 months registered. Sometimes getting subjects, very specialized subjects for these experiments is hugely wrong, hugely difficult. So we took the help of Piramal Foundation, and they were kind enough to help us find this sample. And of course, we used an experimental method to tease out the causal relationship between the interventions and the intended effects. So that's the sort of the big picture. And in terms of the sampling frame, now you might wonder, what is the penetration of WhatsApp or the usage of smartphones in the country? There is a view that close to 40% of rural population now are smartphone users, and about 75% of them use internet. So it's not necessarily a high number now, but it certainly is an increasing number. So basically, we divided the group into those who had access to WhatsApp versus those who did not have access to WhatsApp, and then randomized into treatment and control in both these different arms. That's how we basically structured the experiment. And we did a baseline, we did an end line. I'm cutting out a lot of details here, and we found the following results. Right, these are the successful results that I'm showing here for the WhatsApp intervention. One of them was not statistically significant, which dealt with minimum diet diversity, but nevertheless, the direction of the intervention, the direction of the effect was a good one. And in the other two outcome variables, we did have very encouraging results, which we are pretty excited about, and we now want to use this as a basis to sort of persuade the government to try out a field experiment, move further, and then perhaps even take it to scale after that. So now, one important thing, I mean, I don't have a slide here to show you about the failure of the telephone counseling. That did not work, as it turns out. And one of the reasons that we conjecture as to why the telephone counseling didn't work and the WhatsApp group worked is that telephone, you make a phone call to somebody, and when they receive the phone call at that particular time, they may be busy. They may be engaged in some other activity. So the receptivity to the message that you send through a phone call may not be very high. Whereas a WhatsApp message has that thing about, You can check it at any time. I mean, you can evaluate what you have received at any time. You can engage in a conversation with other people like you. And so all those advantages, I think, came together in producing these results. So this is an example. Have I run out of my 15 minutes, Genofi?
Really close, Pawan.
Okay, all right. So I could pause here, but there's one last point that I would like to make here, and that is, in terms of the methodology of research, on account of the fact that we are working with a client that wants solutions very, very quickly, we are compelled to, in some sense, make adjustments in our research designs. Our sample size comes down, the outcome variables then don't become real behaviors, they become behavioral measures. They're not real behaviors, but behavioral measures. And so the quickness is the key. So there's a trade-off between pragmatism and certitude, right? So do we make a fetish out of certitude is the question, is the big philosophical question to ask. Can we be pragmatic and produce change is really what we are looking at. Thank you. Let me pause there. Yeah.
Thanks a lot, Pawan. That was really interesting. I mean, I've never really seen like a mobile bus lab, which was just really fun to watch. Thanks a lot for your wonderful
You should come and work with us. We will make the bus available to you, Genofi.
Yes, I should. Let's move on to Sharanya's talk now. She's going to talk about how one can leverage social networks and influence as a tool for improving preventive health. Really looking forward to your talk.
Thanks, Genofi, and thank you to IBEN and to Pawan. That was a wonderful, start to this entire session. Are you able to view my slides?
Yeah.
As Pawan was speaking, I was thinking of some of the work that JPAL, has been doing, and a lot of the challenges that he mentioned of working with, in this research policy space and the daily tensions that we face to bring these two spaces together are very real. And I think a lot of these resonated with, JPAL's work in South Asia as well, as Pawan was speaking. So I think for the purpose of this presentation, I thought I'd focus on, a growing body of evidence on leveraging social influence for preventive healthcare, providing some literature of JPAL affiliated professors who have been working for years in this space. So we all know about, the power of behavioral economics in leveraging some of these social aspects of human beings, right? Which is through small nudges or, even very small nudges could have really powerful behavior change impacts. And sort of that is the whole behavioral econ the power of behavioral economics. But I think when we look at social influence, which is an important component of this entire sort of behavioral econ space, I think there are two basic categories that can help us unbundle the understanding of social influence. One is just involving information. How can you leverage social networks to disseminate information of that's relevant and for so key across sectors that's relevant in development programming. And in another the other aspect of this is social influence, which is can influential persons form notions of appropriate behavior which would influence your own behavior and or peer pressure. How could some of these play out when we are designing programs, and how could then this feed into co-designing programs at scale with governments? So I'm going to speak about this through a few examples. And especially, I think the focus is on social networks and social influence to spread information in rural India through information campaigns. So I think, successful diffusion really requires seeding information via central figures. Now, who could be the central figure? I think that identification process is very important, and it is challenging. Because who could be the best candidate? Is it local leaders? Is it village elders? Is it health workers or somebody else? So who is this when we talk about network centrality, how do you really get to it? It's not so easy, because a lot of, should you just ask people? But that's not what a lot of studies actually do, because it's really expensive to do this whole social network mapping, etc. So I think 2 studies have focused on some of these issues. And obviously a logical next step is then what kind of information, once identified, what are the types of information that these sort of so-called seeds can spread for development programs. So this is 2 studies, one in Karnataka, which was the proof of concept, and then following that, a large-scale experiment in Haryana. So exactly this, right? Like, researchers have found, Emily Briza et al. In Karnataka, that the knowledge of people of their existing, network is quite poor. So they may not, for instance, when asked about the link between 2 villagers, they often got it wrong. When asked about, they think that network density is much more than it actually is. And there were lots of errors along the board. So what the researchers did were, Abhijit Banerjee and co-researchers in Karnataka across, this 213 villages that they did this experiment in, they seeded information with a few individuals. And this information, these individuals could enroll in a lottery for a cash prize or mobile phone. So they either got a cash prize or mobile phone. It was a non-rival sort of a setting that they created by giving a missed call to a certain mobile number. Now, who did they seed this information with to spread this information about this opportunity? So in 71 villages, it was just randomly chosen seeds where they selected heads of households, which were randomly selected. In another 71 villages, it was elders that they selected, who are traditionally respected in the society, who are political leaders often, and so on. And in another 71 villages, it was sort of local ambassadors, where individuals nominated others in the village, as well as, who were well suited to spread information. So they were asked about who do you think spreads information in an effective manner? And the results were striking. So the study really finds that ambassadors nominated in this way, who could spread and diffuse information by community members, were better than random seeds or village elders for diffusing this piece of information. And then villages with at least one ambassador saw this kind of ambassador, the information ambassador, saw an average of 65% more calls to the raffle phone number compared to villages with no ambassadors selected via these kinds of seeds. But having said that, I think there are caveats which were important too, because this was proof of concept stage, right? So the caveats were important, that information of lottery may be very different from information on social messaging and development programming, and often sensitive information. Secondly, these elders, which were part of one of the treatment arms which did not work in this case, may have circulated messages more aggressively if they thought that the information was a little bit more relevant, the content. So I think all of these learnings fed into the next policy question, which was about, can you leverage this community nominated ambassadors, which had some positive impact through the Karnataka evaluation? And can they also be good at circulating information on something that's more vital to development programming, something that may be more meaningful, for instance, immunization, improving immunization rates? So we know that this is a big issue in multiple developing countries still, which is that full immunization rates, despite improving avenues for access and putting in more resources for BCG, measles, DPT, polio, still remain quite a huge issue, and especially in multiple pockets of India. So to tackle this gap, how can you boost immunization demand? We worked with the government of Haryana for a very large-scale experiment to work with them to co-design multiple aspects of this program, working closely with the National Health Mission to improve full immunization rates of children. And in 7 districts, which were identified as, in the baseline, which had full immunization rates below 40%, were the 7 districts selected for this experiment. So again, this network theory insights was used to push monthly SMSs and calls with immunization information to nodes that were identified by residents in each of these villages. So this was a subset of 912 villages as part of the larger study, which were divided into 5 groups. And these 5 groups, the way they were identified was again key to this experiment. One was community nominated ambassadors, like the Karnataka experiment. So here, it was important as to how that messaging happened by the researchers when they were identifying. Within each village, there were these 17 randomly selected individuals who were asked to identify people, and within that list they then nominated these seeds, which were community nominated ambassadors. And they asked them, so who really are the people in your village, such that when they share information, it really spreads. It could be about a street play, Nukkad Natak, it could be about a movie screening, and so on and so forth, because either they have networks, they have friends, or because they just actively spread information among villagers. So that was the question that was asked, and then the list was narrowed down. Then the second one was, again, trusted individuals. Whom do you trust with information on, say, agricultural information or health related information? And then the third was a combination of 2. Who are the individuals who are both, whom you can trust, but who also spread information well? And then randomly selected. And then there was this no seeds, who were not provided any of these seeding of information on immunization. The other components of this larger experiment, for instance, included, small incentives to caregivers or parents to really immunize. So this was in the form of mobile-based top-ups, which was different kinds of variants of this were tested, or targeted reminders, reminding them of each subsequent immunization schedule, that you are due for this. So what they found was ambassadors really improved, locally identified ambassadors who were information spreaders really improved full immunization coverage. And there was a 26% increase as compared to the comparison group. Villages with the trust seeds and trust ambassadors, this really did not have any incremental impacts as compared to the random seeds. And this is surprising because to some extent it is sort of surprising, because you would think that something like immunization would require some kind of additional, trust element to it. But it seemed like, this information part was the main bottleneck. And then the SMS messages alone, this was another variant that was tested, where reminding parents of the child, just the SMS, just giving them SMS reminders of the next thing, did not really, again, have any incremental impact as compared to the random seeding. So based on all of these permutations and combinations that was, that were tested across the multiple years with the government, I think the JPAL came up with, the researchers came up with, what is the most effective policy option and what is the most cost-effective policy option. And this combined this network's, insights from this network's sub-study, where it was that the local immunization ambassadors really, this way of identifying people and spreading the message really helped, and combined it with sloped incentives in terms of sloped mobile phone top-ups and SMS reminders, which found the biggest bang for the buck. And the most cost-effective option was the one with, community nominated ambassadors plus text reminders. So I think the larger point here being, when these ambassadors, were identified in this way, creatively, but very simply also by the community, by just asking them, it amplified the effect of other interventions, possibly by, diffusing the information more effectively. And so we are working closely with the government, with the NHM now, to leverage some of these policy lessons of using social networks to, in creative ways, to disseminate such information on immunization, to boost immunization demand, and integrate these cost-effective and effective, inexpensive intervention, variants of this to intelligently combine. So this is where I think insights from the rigorous evaluation, because you could do it in multiple ways, right? Then genuinely before the evaluation, you don't know what's going to work. So when there is that sort of a question, I think insights from rigorous evaluations can be very, very useful in really deciding where is the biggest bang for the buck. And sort of even before widespread adoption, just taking it step by step and supporting the government along the way. How much time do I have, Janofi?
You can take another 2-3 minutes.
Okay, so there's this one other aspect I wanted to share, which is on celebrity endorsements, which, this has again been used as another tool for spreading messages on, health messages, or leveraging social media and other channels. For instance, look at the hashtag of Black Lives Matter, or any of these, which were really, became popular because they were also endorsed by celebrities. So whether and why such campaigns are successful are still open questions, because is it just their reach because they have a larger network, or is it, the additional endorsement power that they bring? And how do you tease out these effects? And whether they actually also then translate into offline, behavior impacts. So in Indonesia, there was this study, which was again looking at boosting, vaccination take-up, where research randomized tweets and retweets of celebrities promoting immunization. And so the tweets that users identified, that they identified as being originated by celebrities, actually they retweeted that a lot more than common people. And so the overall exposure to the campaign also translated into offline beliefs and knowledge on health-seeking behavior. Now, the open question is, of course, can this sort of a scenario be also applicable in a COVID context where there's so much information overload that we all have? Should the information be simple, or should it be more comprehensive because there are so many elements? So I think there's a very interesting study by Professor Banerjee and co-researchers in West Bengal last year in the COVID context, which was, again, looking at this whole celebrity endorsement as a tool, where during the lockdown, we shot 2.5-minute videos, with embedded messages, and they were targeted randomly to 25 million users of a particular mobile phone network, and the rest, the remaining 3 million users of that network were the control comparison group. And these messages, incidentally, were delivered by Professor Banerjee himself, who at that time, he's a native person from West Bengal, and he was covered widely in the media, both because of the Nobel, but also because he was part of the COVID advisory group in the state. So all these video messages actually instructed individuals with cough and fever to contact their local frontline workers. And also there were different variants of messaging that were tested, which was like, some of them were more health-seeking behaviors on hand washing, etc. Some of them was on more motivating action, and some of them was like around ostracizing, the infected, so to not do that. And the comparison group sort of received links to existing information that the government had. And I think this really, this campaign really worked in multiple ways. So the campaign doubled the reporting of health symptoms to community health workers. The rates of not leaving the village, there were lots of people who were found in the baseline who were actually leaving their villages even in that high lockdown sort of stage for various reasons. That reduced hand washing and wearing masks. Wearing masks was actually not even part of the messaging, but there were these spillovers that were found on health preserving behaviors mentioned in the messages, but also those that were not. And so I think the conclusion here was that the results, that even in a high information overload context like a pandemic, there could be additional gains from using respectable figures to endorse, some of these messages, and they could have large direct and indirect links. So I'm going to end here just summing up that there's some interesting insights that we can draw from rigorous randomized evaluations. And here my focus was really on how do you leverage community members' simple observations and use that as an inexpensive method of spreading information, as highly central agents. And second is on the celebrity endorsement of social messages, that could also have direct or direct impacts in adopting health-preserving behaviors.
Thanks a lot, Sharanya. I could see that you had so much and you were talking really fast, so you could cover as much as you can. Thanks a lot for that. It was super informative. And your talk also sort of spilled over into COVID-related talks, which is sort of the webinar for next month. We'll be discussing everything about COVID, vaccination, and all next month. All right, so let's move on to the discussion part of things. So we sort of collaborated with the Behavioral Insights team, and they've given us one question from their side. So we have a question from Luke, who heads the team in Singapore. He says that my experience suggested a strong appetite for putting behavioral approaches into action, but less so to test them. Is that your experience? Has COVID changed this? What strategies have you worked to include evaluation? So I think it's mostly about testing theories that we come up with. What are your views on that? Maybe we could start with Sharanya.
Yeah, I think that's a great question, Janofi. And I think some of the evidence that I shared, this is how we have pivoted to work with policymakers during the pandemic, right? The West Bengal study that I shared. Because you have to be more nimble, you have to be more responsive to the needs of policymakers who have to make decisions on shorter timelines. So I think being responsive in terms of understanding what the current context is, sharing existing evidence. I think a lot of our work, of the policy team over the past year and a half has been also to just sort of make sense of what existing global evidence says and what may be relevant in the current state, what may be generalizable to the current state, what may not be, and having these, a lot of the way in which that we have worked and the research has been shorter term phone surveys to elicit a lot of these information and coming up with these creative strategies to be able to be still relevant and to be able to collaborate with state governments across the board. So I think that is something that I'd open with, and of course, Pawan would pitch in.
So, Janofi, do you want my response to this question as well, Janofi?
Yes.
Yeah. So I think the appetite from the state is dual. On one hand, it's not as if they don't have an appetite for testing. They do want evidence. They do want scientific evidence because they don't want to go wrong, because it's a lot of money that's being spent on programs. And there's a public accountability factor that needs to be met in some sense. So there is a demand for evidence, but there is simultaneously also a demand for advice where there is not much patience for evidence, for the collection of evidence in a rigorous manner and so on. And unless you are able to provide those rapid responses to the government, they are not likely to, in some sense, entertain the evidence part. So in some sense, you got to supply both of them, right? You can't get the ear of the government unless you're also able to talk to them with off-the-shelf advice, with advice based on prior research. For instance, we are working on Esther's sort of iconic work on the 2 kgs dal, right? I mean, there's a lot of science that the JPAL has created. We don't need to recreate the wheel there. So a lot of that evidence can be adapted to current needs, and that's one of the things that we want to do, right? So that's the rapid response part. And by whetting their appetite with this rapid response stuff, you're also creating an opportunity to produce evidence, to ask them to indulge you with some amount of time for you to collect the evidence that can then be rigorous, and then that can be used to inform future courses of action. So it works in both ways, really speaking. But it certainly is the case that the government does also want a lot of advice without the patience for evidence that's collected over a lengthy period of time.
Yeah, I just wanted to add something, hearing Pawan. Another thing I think, that's been important for us in terms of, pivoting and adapting in this particular phase has been, leveraging whatever we currently have and sharing insights that are meaningful that emerge from those in the current context, especially on the implementation side of things. So I know a lot of our researchers in our network who have actually used their study sample to actually do surveys at this time to understand, what is happening to the migrants, what is their nutritional status, what is in the initial months of the lockdown in Bihar and Jharkhand. There were researchers who were looking at their existing study sample. There were, researchers also looking at their existing. There's some scale up efforts that are happening in multiple states. So even looking at some of the data from there, which emanates from the government, to see that, okay, can we do quick surveys to also tell them what's going on so that they can take timely action and course correction. Because I think part of building this trust with governments, it's a long-term process. It doesn't happen. And all of these sort of are very, very important ways of strengthening this longer-term trust building, which has been our main learning of working with, over 20 state governments in India.
Absolutely. I completely
really nice
agree with Sharanya on that. Yeah.
Really, really nice to hear from folks who actually have real experience working with the government. Thanks a lot for sharing that. I have a question which sort of does connect to the previous question. So when and how do you decide if a study that has been done in the Western world, which is the weird countries, can be applied in a setting like India? Like, how do you decide if that can be applied, or if you think it shouldn't be applied? Like, what would be like a criteria that you would personally use? Let's start with Pawan this time.
Yeah, so I have a couple of views on this. So there are two types of behaviors. I mean, you have behaviors which are based on social normativity or culture, as it were, and there's a high degree of variation across geography, right? And then there are also behaviors which are fundamental in some sense. I mean, loss aversion is not typical only to weird countries. I mean, loss aversion is exhibited not merely by humans, but it's also exhibited by monkeys, I'm told. So in some sense, there is a form of behavior that is fundamental, that is common across cultures. And so this whole business of trying to exoticize who we are and say we are so special that all research needs to be replicated in India, I mean, needs to be redone in India, and only then we can sort of move forward, seems to be a bad strategy. I mean, take for instance Abhijit's work in Nigeria, the sugar work, right? I mean, it's the MTV work. I don't see why it can't be applied in India, right? Because it has certain features about human behavior which are pertinent in India as well. So how do you differentiate between these two types? I think I would look at what is fundamental human behavior, which I think travels across context, and the kind of behavior which we know is culturally contingent or which is normatively contingent and so on. That kind of stuff, maybe you need to produce your own knowledge. But to say that we are so special that we need to reinvent the entire behavioral wheel in India, I think is a little absurd. I think that group is going a little overboard. I think they want to feel special about themselves, but that's a different story altogether. Yes. Let me pause there.
Nothing much to add, Pawan. I think I completely agree with you. And I think the one way in which we have tried to do this, just make sense of this black box of what is generalizable, what is not, is to really have a strong theory of change right in the beginning of how really change happens at each, step. Once that theory is laid out, what are some of the core, driving factors or mechanisms driving those changes, and what are some of the more contextual factors that require for that thing to hold, and then checking if the context, if that matters. So do people procrastinate? If people procrastinate and do not follow immunization schedules, maybe that is a starting point for the kind of evaluation that I shared. But at the same time, if there are some other cultural barriers where people are sort of like really averse to the idea of immunization, this may not be the right intervention. So understanding some of the nuances, and then sort of, I think, then customizing the way you operationalize it based on conditions that are specific to a particular, even a state like this. So this whole thing, this immunization study of incentives, and this emanated in Udaipur, but then it was now where it was this dal, what you were talking about, right? 2 kgs of dal and finally steel plates that were given. In Haryana, we've done mobile top-ups, right? So those are then contextual factors that you have to adapt. But are the underlying conditions similar? And exactly to Pawan's point, a lot of this can be drawn from theory of how people behave, right? And if those basic factors of, say, procrastination or these some of these more fundamental, or even we have so many RCTs now saying that the preventive, the cost, the way you cost or price preventative health, that's really the demand is very sensitive to even small changes in the prices, and that is something that is generalizable, that because we've seen it across so many contexts. So we don't have to but then how do you adapt to use that insight to fit specific programs is something that of course would depend on specific contextual factors.
Right. Yeah, makes sense. I think there should be like a little more conversation at maybe a later date about replication and the need for replication and what should be replicated and what doesn't have to be. So I think that's definitely a conversation that needs to be elaborated. Now, Pawan, sorry, you're muted.
One quick thought. I mean, the demand for external validity, I think, is a fair one. I'm not denying that, but that can't become the basis to paralyze paralyzed doing research, right? I mean, and secondly, the realm of commonness between human beings, I think, is a much larger realm than the realm of dissimilarities between human beings, right? So unless you have a meta theory which tells me that this is likely to be different in a different location, why am I reluctant to accept the portability of a particular explanation that I've found in one location to another?
Right. Yeah. Unless the whole process involves like very specific social norms or cultural factors.
Exactly.
Yeah. Okay, so I have 3 quick announcements. It's just gonna take like 2 minutes. So let me share my screen. These are announcements from IBEN. The first one is the Behavioral Economics Lab that we have started. Everything in these announcements relates to behavioral economics research. So I'll be really happy if you all participate in these and conduct your research with us, and also join as a hub. So hubs are different universities who can sign up with us and conduct experiments, basically. So we give them training and teach softwares like Z3 or whatever you need to use to conduct experiments. You can use this link to get there, and we'll be sharing all the talks, the summary, and everything along with these presentations after the webinar. The second one is this academic roundtable, which we're organizing on the 19th of June. So right now we've just invited very, very few academics to take part in this roundtable, and we're planning to invite few more. But if anyone here is an academic, or you'd consider yourself like a researcher in behavioral economics and would like to take part in this, then please write to us at info@iben.co.in, and we'll be happy to send you an invite. We'll prefer if the number is like less than 20, actually 15, so it's like really, really restricted. But if you really want to take part, then please let us know. The third one is that we're starting a completely different research wing, who will then hopefully work with all these other organizations doing great work in India. And again, this is to help with grants specific to behavioral economics, help with collaboration between people, networking among researchers, and of course, do the actual research, and also maybe later on helping with publishing the papers. So yeah, this is coming up soon. And if someone again wants to take part in the research wing, or even like head it or take some academic responsibility there, we'll be really happy to host you as well. So just let us know if you're interested in that. And with that, let's move on to the audience questions. And of course, we won't be able to cover all the questions today, but we will ask the speakers if they have time to answer the questions later. Sure. So we can also send it back to you through the email that we sent. But for now, we have a few questions which we thought were really interesting. So we thought we could start with that. Firstly, I think this is a question to Sharanya. Do you think finding community ambassadors is a feasible strategy to scale across larger target groups and populations?
That's a really open-ended question, but I think a lot of that would depend on both the kind of message that is being spread and the key barrier, right? If information spread in a smaller geography is the main this thing, then community and these networks are strong. Sometimes it's not the case that there are these well-connected geographical networks. Then I think that context would be really important to take into account. And as I said, sometimes the binding constraint may not just be information; it may be that combine plus. So I think to customize and to not generalize to that extent that just having community ambassadors is just the solution would be very important to understand in which context. So, for instance, in agriculture, maybe there is a sometimes these demonstration farms or the peer networks are stronger than just sort of having anybody as a community ambassador. Whereas maybe just if it is an information spreading endeavor, then this would be more effective as a strategy.
Right. Yeah. Pawan, do you have something to add there? I mean, you can always feel free to answer the other person's question as well.
No, I do think that it is a scalable proposition, a highly scalable proposition. In point of fact, as we speak, this is something that we are looking at uh, as a project with Niti Aayog, where we have a centralized kind of a system which has the messages, which is the repository of messages, and then we want to create some kind of an outsourced management system for local influencers who can, so basically we provide the message and we co-brand it with that local person, and the local person has an incentive to spread the message around with his or her image or whatever. And so a village panchayat leader could perhaps send a message with his or her sort of co-branding on that message. So I think it can be scaled up. I think it's a logistical kind of a system. You need to create that platform. We're attempting to create that platform. I think it's a highly. I think it's a great question, but I think there are ways of doing it.
Right. So, I mean, I'm just going through the questions and I see most of them are for Sharanya, and for Pawan, most of them are like, can you please share your slide? It's a great framework kind of questions. So yeah, so I'm just again going to ask question to Sharanya, but of course, Pawan, feel free to jump in. This is actually an interesting question. So did you face any challenges in these communication in terms of building an intent and then further an action? Do the critical notes always lead to a behavior change?
Could you repeat that, Genofi?
Right. So did you face any challenges in these communications in terms of building an intent and then further an action? So was there like an intention action gap in terms of your...
Yeah, so no, I think that's where the different types of messaging and making sure that the team on ground sticks to that, so that you can accurately communicate and find the sort of people that you want to find in each of the treatment arms who would be ambassadors is sort of really key. So the first one was, as I said, the information nodes, right? The second one was the trust. The third one was information and trust. The fourth was randomly allocated, and the fifth is, of course, the control group. So I think this thing about first identifying and then having a very standardized process of sharing that information and then leaving it up to them, because that is the whole experiment, right? Are they voluntarily using their networks to spread this information, and is that having a ripple effect, which is then impacting, which is just providing a quick nudge, which is helping people get over that procrastination of going to the immunization centers. That was the whole experiment. So if you handhold more than that or do anything more than that, the kind of experiment what we wanted to learn would sort of be impacted. So I think having this very streamlined message of communicating how you want to find the nodes in each of the cases, and then sticking to this, provision of SMSs and regular this thing to them, information was the process that was followed.
Right. Pawan, do you have something to add there?
No, I think Sharanya has covered that adequately, and I have not much to add to that. Yeah.
Right. So I can read the next question. It says, do you think digital interventions can achieve effects comparable to personal interventions? I think this is for Pawan.
So per unit impact may be lesser than somebody arriving at your doorstep and then talking to you in person. Mm-hmm. But we are a country of 1.3 billion people.
Yeah.
To what extent can we generate the community? I mean, or to even create the community-based approach will take years, right? So for instance, I mean, we're working on this project with Mushfiq Mubarak at Yale. I mean, he has this wonderful intervention on how to get people to wear masks and so on. And he has great results from Bangladesh, a tripling of effects. But this is a community-based approach. And as we approach governments and so on, we are needing to find the feet on the ground, people who can stand on the streets. So, I mean, the key element of, I think, Mushfiq's work relies on giving somebody a free mask and then standing on the street, and if you see that person not wearing a mask, you tell the person to wear the mask. So it's a normative kind of a pressure. But you need a person there, a person who will go to the household and give a mask, or you need a person on the street who will tell the person who's not wearing a mask to wear a mask. So how do you get those people on the ground is a huge question. Now, does the government have people? Have these people? Do the bureaucrats have the people? I don't think so. It's voluntary organization, it's community civic bodies which have these people. So I think it's best to work with those bodies to get those people on the ground than with the government. So it's a shift away from the government to, I guess, civic bodies to get to do the community based stuff. But the digital stuff, I think, has a wider coverage.
Absolutely.
There's a trade-off between the two, I think. Yeah.
I mean, there's a nice follow-up question here that someone else asked. So how do you proceed with digital solutions in areas with low digital literacy? What would be a nice alternative policy intervention that can be considered in such a situation?
I think this is a great question. So when let's say we are working on a health related area, and oftentimes we tend to think of solutions which are health oriented, right? I mean, changing the behavior. Why can't we think of the intervention as putting up a tower there and getting people internet there? Right? So building the infrastructure is also an intervention that can have positive benefits in health. So we can't just accept not having the internet as a given. I think we need to make those investments.
I think we lost Pawan there. Sharanya, do you want to add something there in the meanwhile?
Yeah, I think, I agree. And these are really great questions, but technology is a tool, right? And I think this digital divide, I think this has become even more important an issue in a time where a lot of those in-person options are not even available at present in the pandemic time. So this on the infrastructure side, of course, these gaps get magnified with the lack of infrastructure. But I would like to add a caveat here that it is not, just technology is a tool, and that alone as a solution to multiple problems might not be just it may not be the main barrier. So it could be that maybe because some kids do not have tools for digital online learning, they are sort of not being able to catch up. But there are evaluations that say just one laptop a child, just throwing laptops at kids without integrating pedagogical interventions alongside, because the whole issue was on learning the learning gap and low learning outcomes, or had no impact on learning outcomes. So sometimes you have to really combine and understand what the binding constraint is and tackle solutions based on that. And a purely tech digital constraint, a tech digital side of tackling the issue may not solve the entire issue, although it may be a starting point. It may be a necessary condition, but not a sufficient one.
I think Pawan's just joining up again. In the meanwhile, there's another question for you, Sharanya. So what can we learn from polio vaccine drive in India? What is the role of trust in the government and vaccine to address vaccine hesitancy? I think that's interesting to discuss the trust in the government and how people adopt these things. So maybe we could talk a little about that.
I think Pawan is back, so maybe he wants to go.
Hi, Pawan.
Hi, Isha. So trust in the government, it's a very, very difficult question to answer. I really don't have, I can't appeal to any evidence that tells me something about the relationship between the trust in the government and the adoption of vaccines and so on. But so there is some work that we have done on the adoption of HPV vaccines in West Bengal, for instance. And our work indicates that the role of physicians perhaps is far, far greater than the role of the government. Although using images of, sort of noted people, noted physicians is likely to produce we ran some experiments, and that indicates that parents are more willing to get their kids vaccinated with the HPV vaccine. So, yeah. So the government itself, trust the government itself, is an ambiguous concept, because what do you mean by trusting the government? The government is an amorphous body, and oftentimes trust literature talks about trusting specific individuals as against large bodies as such, right? I mean, so I really don't have a meaningful or a sensible answer, because I don't know if we have any evidence to talk about that.
Right. Yeah, makes sense. Yeah.
Yeah.
I would like to end this with one last question, which is not exactly the question that the person has asked, but I'm going to make it a bit more broad. So how do you feel about qualitative research to capture the reality versus quantitative research? And what would be a nice balance to have? I'm asking this because this is a webinar on research per se, so that'll be a nice thing to talk about.
Listen, I'm a sociologist by trade, and I got into social science. Although I have a background in mathematics, I straddle both worlds. I run experiments, and I also enjoy doing ethnography. I think the power of qualitative work is often, undermined by the machismo of quantitative, right? But I think qualitative work produces a third dimension in our understanding of human behavior, which quantitative work doesn't necessarily always produce. So, the gold standard really is a mixed approach. To have some qualitative work, to go out and have conversations with people, which gives you a very deep insight to why people do what they do, and then bring it back, and then you do your sort of experiments, or you do your observational statistical pieces. I think a combination of both, I think, is essential, right? So I wouldn't. So this whole business of belonging to either of these two groups doesn't make sense to me. I think there's tremendous qualitative work out there, and there's tremendous quantitative work, and combining best of. But there's one caveat that I would like to add, and that is, I think a lot of qualitative work has been hijacked by postmodernism, where there is a certain measure of deliberate obscurantism, where style precedes substance. And that is the danger that you need to be careful about. But analytically driven qualitative work, which is positivist, which identifies good explanatory variables, can be really very powerful.
I'd like to echo what all that Pawan said. Actually, it has to be a sort of complementing each other, qualitative and quantitative approaches. So while, of course, for the the purely causal questions, you have to we use RCTs as the main tool of teasing the causal impact of any development program or intervention or approach at hand. But what goes in designing that, for instance? Right? Are you asking the right questions? And this is the whole, in the beginning, especially in the initial stages, I think the qualitative piece is just so important, because maybe you're barking up the wrong tree, and then you don't want to spend all of that money, because large scale and long-term experiments are also sort of they require resources and time. So I think this combination of qualitative and quantitative is sort of super important to make sure that you're asking the right questions, and then of course following through, understanding the depths of impact and all of those nuances.
Absolutely. Oftentimes I feel that if you send in 5 people to have conversations, they can come back with a wealth of information. And sometimes you don't need to do a massive survey to discover reality. You don't have, as Bob Dylan would put it, you don't need a weatherman to know which way the wind blows. And so so qualitative work has its place. Conversations have their place.
Yeah,
they're epistemically as foundational as quantitative.
Yeah, very true. Yeah. I mean, like throughout my career, I was with the econ folks who really, really overvalued qualitative stuff. And then I started working with anthropologists, political scientists who also look at the qualitative stuff. And it's actually really interesting. Like you get insights you would never get with just numbers, right? So
absolutely.
Wonderful. Thanks a lot, Pawan and Sharanya, for the amazing discussion and the really, really insightful talks. And I'm pretty sure everybody feels the same way, that it's been great, it's been super useful, and thanks a lot for your time. And thank you everyone for joining us today. And we, as promised, we will send you an email with all this information and a lot of fun reads for you to do after this webinar. Thank you then. Bye-bye.
Thank you. Thank you so much for having us. Thank you.
Thank you. Thank you, both of you. And Divya and Shardul and all the participants.